Vision FM. Anything else would be far too boring. Vision FM. Anything else would be far too boring.
Wake up, Sokoto.
It's only in Nigeria you come and buy a car to Kumbo. Together with you come and buy a car to Kumbo, people coming to congratulate you.
When you are providing a good governance, you must understand the problems of the people, what they need.
There is a lot of complaints from people from Sokoto State.
He was the same person that told us he used technology in fighting corruption when he was in power.
We discuss issues in the state, in the country, and your opinion matters. Wake up, Sokoto.
The federal government has not been funding the existing universities. And of course, it went ahead to establish other universities. It is irrational when you cannot even deal with the existing universities you've established, and yet you go ahead to establish other ones for political
Wake up, Sokoto. Mondays to Fridays, 10 a.m. every weekdays on Vision FM.
Alright, thank you very much for joining us today on Wake Up Sokoto on Vision 92.5 right here in Sokoto. Wake Up Sokoto is a program where we discuss issues affecting Nigerians and Nigeria. Wherever you are, just make sure you stay with us, as today we're going to be talking about an important issue, talking about health insurance, and of course let's talk about this with you, the importance, and let's see the way out. You can get into the Sokoto State Health Contributory Health Scheme and actually get to benefit from it. So wherever you are, just make sure you stay with us. My name is Lawal Aliyu, and welcome to Wake Up Sokoto. Good morning, Nigeria, and good morning, Sokoto. Alright, this is Wake Up Sokoto. The first 30 minutes is between the guest and the presenter, and they are about way off on the phone lines for you to contribute on the topic of discuss this morning. Let's take a background of the program. Sokoto has an estimated population of 5.3 million people, with about 4.5 million without health insurance, in an effort to ensure the actualization of universal health coverage for the indigent, poor and vulnerable residents of Sokoto State. The United States Agency for International Development funded health, finance and governance project support to mobilize of their domestic resources, reducing financial barriers, expanding health insurance, and implementing provider payment system. The support resulted in the establishment of Sokoto State Contributory Health Care Management Agency, SOCHEMA, bill in 2016 by Governor Aminu Waziri Tambol. In anticipation of the actualizations of this scheme bill, the project conducted a wide array of efforts to engage statewide stakeholders by in through workshops and advocacy visits. The Sokoto State House of Assembly conducted a public hearing on the SOCHEMA bill that was attended by key stakeholders from different sectors, including community, religious leaders, trade unions, labor unions, MDAs, professionals, and the private sector, who expressed their endorsement. The SOCHEMA bill was passed into law by the House of Assembly on February 2018 and has been launched in July 2018. Key stakeholders in the state are excited and have branded the passing of SOCHEMA bill into law as a legacy of the current administration as captured in the then Shehu Kakale, Balarabe Kakale, the Honorable Commissioner of Health. And in this view, we are going to be talking about the contributory health scheme. And with us, we have the partners in this project or program, Mr. Lekan Ewanla of Ultimate Health Management Services. You're welcome to the program, sir.
Thank you so much. Good morning, Nigerians.
Good morning. Okay, let's talk about this. Talk about health insurance. People really don't buy into this health insurance. What are the basic benefits of this health insurance?
Okay, thank you very much, the presenter. It's my pleasure being here this morning. Let me take it off from where you stopped, because in the course of the introduction of the background of the program, you did mention the involvement of international donors.
Yes, sir.
With the states. And that's where I'm going to start from. You see, the concept of making healthcare affordable, accessible and equitable was a global agenda for all member nations, or is a global agenda for all member nations of United Nations. And it is mandatory for all member nations of United Nations to ensure the well-being of their people back home. And what brought about health insurance is the fact that poverty has really affected the well-being of people across the globe. So people find it so much difficult to pay for their healthcare needs when the need arises. And the government at the global level began to look at the best way to make healthcare accessible. And the only way this could be done is through the contributory health management process, whereby everyone will contribute a token of their income into a larger pool. And whoever is in need of healthcare is thereafter treated from that pool and paid for. Because the fact remains that it's not everyone that will fall sick at the same time. So the healthy cross-subsidize the healthcare needs of those that are sick, while the rich also cross-subsidize the medical needs of the people that are living below poverty level. I want to say that is the concept. And in Nigeria context, health is on the concurrent list in our constitution, and that translates to the fact that states of the federation, starting from the federal states, are expected to make provision for the healthcare needs of their people. And this is also, I needed to clarify this is divided into two, because everyone living in every country across the globe are divided into two. Yes, we have the formal sector, we have the informal sector. The formal sector are those that are working for government and for the organized private sector. And I would like to say at this point that the population of the formal sector across the globe is far less than the population of those that are working in the informal sector. In the Nigerian context, I guess we put that at between 14 and 15% of the entire population, while the remaining 85% goes for those that are in the informal sector. And at this point, I also would like to quickly go back to your introductory part of this program by commending the present administration, that's the governor of this state, for deeming it fit to key on to this as fast as he could. It's quite commendable that the governor is on the same page with the global phenomena, is on the same page with the international donors. Equally appreciate the wellness, the importance of the well-being of his people back in Sokoto State. And he worked towards the accelerated passage of this bill. Not only that, he's equally, holding the bull by the horn to ensure that the health insurance program takes off in Sokoto State. I would like to say once again that is commendable, and I want to commend him for that, with his team of experts that are working with him.
Okay, many will not know the importance and the benefit of this health scheme. Will you actually explain to the people of Sokoto the benefits they are going to drive on this health insurance scheme?
Okay, thank you very much for that. Let me clarify this with a very plain example. Okay. In every household, we make sure that we make provision for what we are going to eat, not until when we are hungry.
Yeah.
And that is the way the individual family, irrespective of their financial status, organize their well-being. I mean, their living process.
Okay.
So the same way, healthcare. The concept of healthcare is making contribution and having the ability to access care when the need arises. Before now, most Nigerians don't make provision for their healthcare needs. And if there's anything that would not tell you when it's going to come, is sickness. We all know that, yes, once we have our breakfast in the morning, certainly we're going to be hungry by afternoon, and we have to find something to eat. And we look forward to it, and we make provision for that.
Yeah.
So the concept on the table that government is putting across to everyone is that we need to deploy that same concept towards the management of our healthcare.
Okay.
Such that on this health insurance program or contributory health management program, you would have the opportunity of choosing your hospital based on your area of residence. You also have the opportunity of knowing the medical benefits that you are entitled to on this program.
Yeah.
In addition to that, you are equally encouraged to seek for preventive health care. Okay. And don't wait up until when you're sick or when you are in need of medical care, healthcare services, because you see, healthcare is divided into two, and we all know globally that prevention is better than cure. So on the contributory healthcare management, it is encouraged emphatically that you seek for preventive healthcare so that you can prevent sickness and get better, and also change your lifestyle and improve on your lifestyle so that you can continue to live well.
Okay.
Across the globe, it is not destined that people should just die anyhow. But you see, where poverty is so prevalent, whenever anything bad happens, we put it on the doorstep of God.
Yeah, okay.
And Nigeria being a praying country, we believe so much that anything that happens is from God. But the truth of the matter is we need to begin to change that perception.
Okay. Because
should you fall ill and you have the ability to access care, I honestly would love to say on this program that it must not translate to this.
Okay. The bill was passed into law in 2018 and it was launched in 2018. Looking at the time and let's talk about the engagement of people of Sokoto State in this scheme. Are there improvements in the enrollment of households into the scheme?
Let me use this opportunity to clarify the fact that the activation of this contributory health management program comes in 2-3 folds.
Okay.
For instance, the federal government is providing some funds for the vulnerable in each state of the federation.
Okay.
And at the same time, I would like to clarify on this program that in the history of this nation, this is the first time that we have government-to-government collaboration.
Okay.
And government is equally taking healthcare needs from both demand and supply value chain.
Okay.
Because now government is providing some funds for the National Primary Healthcare Agency to enhance the refurbishment of primary healthcare facilities across the state of federation.
Okay.
And at the same time providing funds through the NHIS to take care of those that are vulnerable in those states, assessing care in those refurbished primary healthcare centers.
Okay.
Having taken care of that, the government is equally insisting and suggesting strongly that whoever is going to access those funds must, any state that is going to access those funds must ensure the passage of the health insurance law, such that it becomes mandatory for everyone to access care.
Okay.
And that is where we are now. That is the first leg, and that's what we call the basic healthcare fund for the vulnerables. That is ongoing in all the states of the Federation as we speak today.
Okay.
At the same time, that is working simultaneously or pari passu with the passage of the law to ensure the mandatory compliance with the health insurance program for the sustainability of this program and to ensure that people get well across all nations in the country. So that is ongoing, and the state or Sokoto State as we speak now, I guess they are already working on the implementation of the basic healthcare fund, and while that is ongoing, they also simultaneously activated the health insurance program. And part of the things that brought me today was to interface with the Sokema to commend them for a job well done, and to also see the area of collaboration, the area of technical support, because Ultimate Health HMO has been in the health insurance industry since 2004. Personally, I've been a managing director in this industry since 2005 till date.
Okay.
So, and I have been opportune to be exposed to the concept of health insurance across the globe.
Okay, so you were working a working partner with the health insurance.
Yes, let me quickly clarify all of that too, because that is equally very fundamental to be clarified on this program.
Okay.
The development strategy for all nations is well spelled out, and the strategy for Nigeria is that it's no longer government business to do business. So government is going to create the enabling environment for the private sector to drive the economy, while government regulates.
Okay.
So that's why you see that at the federal level we have the National Health Insurance Scheme, who is the regulator of health insurance in Nigeria.
Okay.
It is the basic responsibility of NHIS to set and enforce accreditation requirements and quality standards for the healthcare providers and the health maintenance organizations. So the health insurance program in Nigeria is meant to be driven by health maintenance organizations that are expected to be accredited by the National Health Insurance Scheme.
Okay.
And once a health maintenance organization is accredited by NHIS, that HMO is expected, to operate in any parts of the country, depending on the status, because I think it's equally very necessary to highlight the fact that there are three categories of HMOs in this country. We have state HMO, we have zonal HMO, and we have national HMO. So Ultimate Health HMO is a national HMO. Our head office is in Lagos, it's in Abuja, and we have offices in the 6 geopolitical zones, including Sokoto.
Okay.
We've been in Sokoto for the past 4 or 5 years.
Oh, wow.
Working closely with the government to ensure the smooth takeoff of this contributory health management program.
Okay.
And it gladdens our heart to say on this program that always at the end of the tunnel there will always be light, and there is light now.
Okay.
So the program is taking off.
Okay, so let's talk about this. For every program to succeed, there must be some level of awareness. Creating awareness to public to know the importance. How far have you gone in creating awareness on this program, health insurance program?
Yeah, we as an entity licensed by the NHIS to drive health insurance nationally, we have embarked on strategic media campaign across the nation. We have billboards in Lagos. We have already erecting 2 in Kaduna, and same in some other states where we run health insurance program. And I would like to say on this program that we certainly going to erect billboards in Sokoto State, and that is going to be in addition to strategic media campaign on radio programs like this and other platforms that could translate to top of mind awareness for all concerned, to really get to understand the importance and the benefits inherent in the contributory health management program. It is quite wonderful. It's the only solution that could lead to the awareness of people.
Okay. And
government is meticulously monitoring the implementation of this across states of the Federation, and whatever challenge or challenges that are identified in a particular state. I also would like to say that we as critical stakeholders on this program are working closely with the states to provide solutions And I say solutions including tailor-made solutions to those challenges, because they could be peculiar. And that's why someone like me is here in Sokoto today to interface with the Sokema leadership.
So now we find out sometimes, often, you find potholes here and there in projects or programs like this. Maybe people registered, and at the end of the day they find out not to be those services are not provided to them effectively. What have you been doing to ensure that if you register with the contributory health, all the services you need will be provided to you?
Yes, we know that the health insurance program is quite unique and so novel, and is equally very new in our environment here. So quite a lot of the critical stakeholders may not really possess the required knowledge or the technical know-how to drive the process. And like I have said, I have been opportune to be exposed to this program across the globe. So what we do in ultimate is to provide solutions and capacity building programs for the critical stakeholders. When I say the critical stakeholders now, we're talking about even the healthcare services, the healthcare providers rather. Yeah. Thereafter, we also highlight the benefit packages to those enrollees, because it's important that they know what they are entitled to. If you're given a ticket by the state government to enter any government or any restaurant in Sokoto and eat any type of food, you must know the limit to how far that ticket can give you. So that is very important. So the benefit package is well spelled out, and it is the responsibility of the critical stakeholders like Ultimate Health, working closely with the agency as the regulator of the scheme, to create top-of-mind awareness to the critical stakeholders. And these are basically the people that are going to be enrolled on this program. And thereafter, as we're doing this, we're also carrying along the healthcare providers, who is going to be in charge of service provision, so that everyone knows what is right, everyone knows what is not meant to be done, and everyone knows what is meant to be done as well.
You're listening to Wake Up Sokoto on Vision 2.5 right here in Sokoto, and we're talking about health insurance, and we have Mr. Lekan Awenla of Ultimate Health Management Services with us in the studio to discuss this important issue that will benefit, surely that benefits the people of the state. And we'll take a break. We will be right back. After the break, we'll open the phone lines for you to ask questions or seek for clarifications on some issues. So we'll be back. Welcome back as the Wake Up Sokoto on Vision 92.5 right here in Sokoto. And I told you earlier, we're talking about health insurance and the Sokoto State Contributory Management Agency program, which has been launched in 2018 by the state government and some developmental partners in the state. 07055726849 and 07049222925 and 07049219925 is the number you can call us and ask questions or seek for clarification on the topic. today, you can have one or two things to ask. Let's talk about this with the people of Sokoto, and let's hear your inputs on how this program will be successful in the state. 070-5572-6849 is the number, and 070-49222925 and 070-4921-9925. We have a caller on the line. Hello, good morning.
Good morning.
Good morning, how are you?
Good morning to the guest in the studio. This is Rabiatu.
Okay, Rabiatu.
Thank you very much. As we all know, health is the bedrock of every human being to live in a proper and normal life. Without health, we can't do anything. So it is very important for one to have that health insurance.
Okay.
Because it will help you in the time, maybe in the future time, maybe you don't have money and you fall sick, the insurance will help that person.
Okay.
To give you medicine in the lower price, or sometimes in the insurance they give their patients free in charge of medicine.
Okay.
As we know that yes, even this we have health insurance in terms of this fire precaution, and also they help that person to repair that house, anything that happens to that house.
Okay.
That is how the health also be.
Thank
so
you.
It is very important and it is a very welcome development.
Thank you.
Thank you very much.
Thank you very much for your contribution there. 070-5572-6849 and 070-49222925 and 070-492-1995 is the number you can call us. You can also send us a text message via the number 09081065024 is the number you can send us a text message. Okay, I would like to go back to the guest in the studio. Okay, let's talk about this contributory health management. Many people will want to ask, how are they going to get registered on this scheme? So can you tell us the procedure?
Thank you very much for this fundamental question. The registration process is so seamless. The agency that is the regulator, that's Sokema in Sokoto, has already developed the operational guidelines for this to be done.
Yeah.
And basically the private partners like Ultimate Health HMO are the ones that will anchor the registration process.
Okay.
We're going to create a registration point in each of the local governments, and even the state ministries and agencies that has been allocated to us. We are the ones that would do the registration right on the process. Right on the spot. And part of the things that brought me to Sokoto yesterday, I'm going to have a meeting with the management of Sokema this afternoon, is for us to generally review the registration process to make it a lot more seamless and to make it a lot more faster, so such that we can even register everyone in a particular local government to create a data for them. And by the time the premium is coming up, we just pull out the name of the whoever has been captured and we just activate.
Okay.
So those are the processes that we are going to look at. But I can assure everyone living in Sokoto State the desire of the state government is to ensure that everyone is covered, because the health insurance program is mandatory for all residents of Sokoto State.
Okay.
So that's the mandate, and it must be achieved.
Okay.
It must be achieved.
So you said you are going to create a registration point in all the 23 local government of the state, so that people can go there.
Let me clarify that Ultimate Health is not the only HMO or the third-party administrator that is working in the state. The agency has actually appointed the required number or numbers of the third-party administrators that will be required to deal with this registration process in all these local governments of the federation of the states. So we have been allocated our own local government, and as a matter of fact, this afternoon we are meeting with the local government chairman and the community leaders in those local governments.
Okay, so you are going to be in charge of a local government yourself?
For now, yes, in local government, in addition to some state ministries, agencies and parastatals.
Okay.
And those ones that are given to us are certainly going to be registered as fast as possible. Let me quickly clarify this. Whatever standard we deploy is the standard that would be deployed across all the third-party administrators for the state to ensure uniformity, to ensure speed, and ensure compliance.
Okay.
And that is it.
Okay. You're listening to Wake Up Sokoto on Vision 92.5 FM. If you are just tuning in, we're talking about the health insurance, and we have Mr. Lekan Ewenla of the Ultimate Health Management Services talking about this important, program on the radio. So whatever you're doing, just make sure you call us and ask one or two questions so that you can be part of this program. 07055726849 is the number, and 070-49222-925 and 070-4921-925 is the number you can call us and ask us. And remember, you can also send us a text message via the number 9081065024 is the number you can call us and have your say on the topic this morning. Before then, we've been talking about this contributory health management, how people can really contribute. When you hear contribution, some people will say, I would not want to get into contribution sometimes because maybe I'm not going to get the desired result. What is your assurance to the people?
Thank you very much for this too, because it's very important for us to clarify on this program the fact that the contributory health management program was designed to ensure the well-being of everyone in the states. And like I did say, in the course of this program, it's not meant to cover or to focus strictly on curative, and that's just treatment of sicknesses. It is meant to, first of all, address the issue of preventive, because we all know that prevention is better than cure. So on this program, the issue of what happens if I don't fall ill does not arise, because this program is designed to ensure that we begin to change the mindset and the psyche of people towards accessing care. Before now, people don't go to the hospital until when it is getting to emergency level. And why they do that was basically because of lack of money in their pockets. But with the contributory health management program now, each and everyone that is enrolled on this program is encouraged and advised strongly to seek for preventive health care, such that you can wake up, you can go to your chosen hospital that you have chosen and seek for some checkups that could just give you an idea of your state of health. And that puts your mind at rest, because once you know that you're healthy and it's just for you to live right and eat whatever you needed to eat, you're good. Even if there are some health challenges, that is not a big deal, because everyone there's bound to be one challenge or the other in one's life. And that shouldn't create any panic.
We have a caller on the line. Hello. Good morning.
Hello. Good morning.
Good morning. How are you?
Morning, sir. My name is Bello Ibrahim, and I'm calling from Tamaj area.
Okay, Bello Ibrahim, go ahead.
Yes. Please, I need more clarification on this, because we just had a case in my place where I work. There is a clinic there. And this clinic is one of the clinics that has been set aside for NHIS. And then it happens that whenever our staff go to this place, they will not be attended to. In the sense that the people there will complain that there is no medicine, there is no this thing to give, or drugs to give to the members of staff. And then this has become an issue, not only even to the unions in that organization, and it becomes a worried something that every union is discussing about it.
Okay.
Now, I want to find out from the resource person there, please, even though I don't know his name. Please, sir, what can we do in this kind of situation? Our money is being deducted. And whenever we go to this place, we find that there is no services given to us.
Okay.
What do we do?
Okay.
Okay.
Yes.
I want to thank you
Thank you
so
very
much for coming out to state this particular issue. First of all, let me clarify on this program. With the health insurance program or contributory health management program, facilities, and that is healthcare facilities that are enlisted as service provider by NHIs on this program are not expected to do any form of prescription for anyone to go and buy their medication outside. No.
Okay.
Let me also go a step further to clarify the fact that on this contributory health insurance program or health insurance program the Nigerian government is driving, there are two risk takers. The primary provider is a risk taker at the primary level, and that is why a certain percentage of the premium is paid upfront to them for them to bear that risk at the primary level, while the third-party administrators like Ultimate Health is the risk taker as the secondary and tertiary levels.
Okay.
And that's why you see that whenever there's a service that is not within the coverage of the primary provider, they call the HMO for referral, and the HMO give them the approval code for that enrollee to be referred. Now, having been facing this challenge at this level, I think it's important that maybe I'll give you my number. You can talk to me after this program, because there's a need for us to interface with that facility to educate them. They may not understand the issue of why they are doing all of this, because as a primary provider, whoever comes in is meant to be attended to like a king and queen. And whatever medication they are needed, that is needed by them, must be given. If it is not available as at the time they are in that facility, they probably ask them to come out and pick it up.
Okay.
Because what has been seen to take people from above the poverty line to below the poverty line almost immediately is the prescription for medications. If it is not within the reach of the people that are accessing care, certainly it will lead to...
Hello, good morning.
Good morning. Hello.
So let me quickly give them my number.
We'll give them back. Hello. Hello, who is on the line?
My name is Sani Mohammed Gobra.
Okay. Sani Mohammed Gobra, you're welcome to the program.
Thank you. See, I think from the beginning, the first NHS, especially brought by the federal government, people in this area could not utilize it because of religious issues. But alhamdulillah, when His Excellency Governor Amin Waziri Kambwa contributed 100 million to adapt and call Islamic scholars and all knowledgeable in health care, established its own version in the state. People have been advancing it and others. My question is, what is the difference between the NHS is talking about now and that of the state government?
Okay.
Because people have been convinced that the state government has introduced something better, which they are now, even if you didn't, whatever you contributed, if you utilize it in a whole year, you are also giving it to other people take care of their health. And that is sadaqatu jariyah according to Islamic law. So I want just to know the difference between the state government's health contributory and that of federal government. Thank you very much, Allah.
Thank you very much, there, Alhaji Sani Muhammad Gobra.
Yes, Alhaji Gobra, that's a very good question. Let me quickly clarify the fact that the contributory health management program that is being driven in Sokoto State and in the entire northern region has taken care of the religious challenges and even the cultural challenges, such that whatever contribution is made is managed by the agency, and whatever is remaining can be invested in an Islamic compliant business. And I also would like to clarify at this point that about 80% of whatever is contributed is certainly going to be utilized based on actual reports.
Okay.
And this is not insurance, because insurance is completely against the tenets of Islam. So that has been taken care of in couching the law establishing this contributory health management program. I know that we have reviewed a lot of trade literature concerning Takafu and the rest of them, and all of these peculiarities and the principle of beliefs has been pulled out to ensure the protection of the beliefs of the religion, and that has been taken care of. I would like to just stop at that.
Okay. Yeah. All right. You're still listening to Wake Up Sokoto on Vision 92.5 FM, and we're talking about contributory health scheme of the Sokoto State government, and you've had a lot of contribution from an explanation from the guest here on the program. So you can call us right now, 070-5572-6849 and 070-49222925 and 070-49219925. Is the number. You can also send us a text message via the number 09081 065024 is the number. You can send us a text message right now. Okay, we have a text message. Good morning to you, presenter and the guest. May we know if you're registered for like NHI, and you've been visiting a designated health facility that has been accredited for the health insurance, and you have not been receiving your services, what will you do? Where are you going to report those facility? That's the question.
Yes, thank you very much. The question that has just been read out is very similar to the one that I tried to explain earlier on.
Yeah.
Yes, if you have chosen a particular facility and you have not really been adequately attended to the way you desire, certainly you need to talk to the health maintenance organization that is in charge of the health insurance program or the contributory health management program.
Yeah.
The third-party administrator are the private private investors in the healthcare space, and they are like health auditors.
Okay.
So they interface more effectively with the healthcare providers, and they possess the technical know-how. So, and in the ID card that is issued to everyone, I want to say on this program that the contact telephone numbers, most especially the call center for the third-party administrator, should be clear enough at the back of the ID card, and they are meant to provide that service 24/7. And I want to re-emphasize the fact that it's meant to be 24/7, so that even while you are in the facility and you are not being attended to in good time, you have every right to call the third party administrator or the HMO and tell them that I have been here for the past 2-3 hours and no one is talking to me, and they will touch base or call them immediately, and that issue will be resolved.
Okay. All right.
So like I was saying earlier on, I think it's important for me because I'm quite disturbed that facilities, we still have some facilities that are not doing the right thing. And if they are not doing the right thing, it's our responsibility to ensure that the right thing is done. And I would like to interface with whoever has issues or have issues on this program. They can reach me on 090-956-77777.
Okay.
And I can address this because as an HMO, we are not just driving an HMO now. We are a solution provider working closely with the NHIS to ensure that the right thing is done and to ensure that we create the necessary awareness for everyone that is meant to be part of this, and that is talking about those that are meant to be enrolled and also those that are providing services on this program.
Okay.
We've seen that as a major challenge, and we've taken it upon ourselves to ensure that we create the desired awareness for everyone to key onto this program. Because it's only us, it is we that will develop this country and not anyone else.
Okay.
Yeah.
So now, your message to the people of Sokoto about this particular program that is contributory health management before we wrap it up.
Yeah, my message to the people of Sokoto State is to encourage them to seek for knowledge on this program, because this program was designed or is designed to enhance their well-being. The benefits on this program is so wonderful, and it is when they understand the importance of having unhindered access to quality healthcare services that they begin to appreciate what the government of this nation is doing. So if government is setting the table for everyone to have a meal on their table, that meal must be assessed, that meal must be eaten, and that's the concept. So I think this contributory health management program, it is meant to ensure that whoever is enrolled on this program have access, good access, unhindered access to both preventive and curative healthcare services as desired at any point in time. Okay. And it's a yearly premium thing. So if you do it this year, you renew next year. Because we can't say the same thing we renew the particulars of our vehicles is the same thing we renew this health insurance program.
Okay. Thank you very much for your time, Mr. Lekan of the Ultimate Health Management Services. Thank you very much for having the time to be with us this morning.
The pleasure is mine. I want to thank you so immensely for your contribution and support in this regard.
All right. Thank you. You're welcome.
Yeah.
And this is the size of the program we have for you this beautiful morning. And do well to join us tomorrow with another edition of the program, Wake Up Sokoto. On behalf of the producer of the program, Abubakar Suleiman, I remain Lawal Aliyu saying, good morning, Nigeria. Good morning, Sokoto.